afternoon. We are here in Lisbon in the context of the 6th EAACI ISMA meeting, and we have the pleasure to interview Professor Hans-Jürgen Hoffmann, who is professor in allergy and lung immunology in the University of Aarhus in Denmark, and who has recently published in the journal Allergy Journal, a position paper on the clinical utilities of basophil activation test. Can you please explain which markers are used to measure basophil activation by flow cytometry, and what are the advantages of flow cytometry over other techniques to measure basophil activation like histamine release, please?
Okay. Thanks very much. We use CD63 as a marker for measuring basophil activation. CD63 is located in the same vesicles as histamine and other granular substances and is upregulated to the cell surface once the basophil is activated. The advantage of using flow cytometry for basophil activation is that you can identify basophils in whole blood amongst leukocytes, so you do not need to purify the basophils to do the activation testing.
Okay, many thanks. And in the paper it is written that to interpret basophil activation test, two concepts must be considered. One is basophil reactivity and the other is basophil sensitivity. Can you please explain what these concepts imply for the interpretation of the test?
Okay. Basophil reactivity reflects the number of basophils that get activated at a given allergen concentration and is indicative of the severity of symptoms in food allergy. This has been shown by Alexandra Santos and a group in New York. Basophil sensitivity reflects the threshold at which patients will react, so the allergen concentration at which they actually will react, and can only occur once you have reactivity. So basophil sensitivity is normally what is changed during treatment with allergen immunotherapy or with anti-IgE treatment. Basophil sensitivity is measured by assessing reactivity at different allergen concentrations and determining at which allergen concentration you have half maximal activation.
Okay, many thanks. And in the paper it is explained many different utilities of this basophil activation test. Can you explain us briefly the potential utilities of basophil activation test for diagnosing IgE-mediated diseases, please?
Thanks. Basophil activation testing is very, very well suited to diagnose IgE-mediated allergy because it really detects cross-linking of IgE on the basophil through allergen. So it can be used to diagnose drug allergy, it can be used to diagnose food allergy, it's useful in diagnosing Hymenoptera venom allergy, and it's useful in also diagnosing difficult cases of respiratory allergies.
In the paper it is suggested that the basophil activation test can be also useful for the diagnosis of some non-IgE mediated diseases. Can you please explain how this test can be useful in this setting, please?
Okay. There are two instances in which we diagnose non-IgE mediated conditions. The one is chronic urticaria, where we detect antibodies, autoantibodies against IgE, the IgE receptor or other activating molecules on the surface of mast cells and basophils. The other instance is in drug-mediated allergy, where we do not know precisely whether this actually is IgE mediated, but it's a hypersensitivity response that is particular to basophils and to mast cells and is likely to be the cause of the iatrogenic exposure to the drug.
After allergic diagnosis, when we already have the disease diagnosed, is basophil activation test also useful for the management and monitoring of patients with allergic diseases?
Indeed, basophil reactivity and sensitivity are useful for monitoring allergic disease. Examples of this are in food allergy, where small children often outgrow their allergy, and when they outgrow their allergy, their sensitivity and reactivity towards the allergen will change. Also, you can determine whether they can tolerate processed food like cooked or baked food. We also use basophil sensitivity to monitor allergen immunotherapy, and this has great potential because in some instances in allergen immunotherapy it's very dramatic to challenge the patient. For example, in Hymenoptera venom allergy treatment, where you would have to have a live bee or wasp to sting the patient. And here, if we can establish that basophil sensitivity changes can reflect the protective effect, we would save the patient a lot of exposure and we would really make life a lot easier in the clinic. The third aspect is in allergen immunotherapy for grass pollen allergy and for anti-IgE treatment, where we can monitor the degree to which basophils become less reactive after anti-IgE treatment, and we can see that patients that do not respond, we can see whether they would benefit from just increasing the dose or whether we need to take other measures into use to control the disease.
So many thanks.